So day one post-op, you'll be reviewed by the resident medical officer on the ward and your consultant surgeon. By the end of day one, it is expected that you'll be mobile with 2 crutches, you would have practiced the stairs, and you'll be dressed in comfortable home clothes. You would have had your blood tests, and an X-ray would have been taken for us to check that the components were all appropriately seated and positioned. It is potentially possible to be discharged by physiotherapy on day one if you're flying, which means you can potentially go home that day, if not swiftly the following day. So day two, everybody recovers at different rates, so more physiotherapy may be required. Most patients, as I say, go home with telephone support when medically fit to do so. They're discharged with a 4-week course of oral anticoagulation. A follow-up appointment will be arranged in advance to see us again at 6 weeks. Outpatient physiotherapy will also be set up for you. If you live in the vicinity of Benenden Hospital, then you're welcome to come back to have it with the team here. If not, we will help you arrange it in your locality. And seeing a physiotherapist on a weekly basis, in my opinion, is absolutely essential to get a good result following hip or knee replacement surgery, because they make sure that you meet the milestones in the recovery passage. And again, hip precautions for the first 6 weeks, the physiotherapist will drum these into you whilst you're on the ward, and you'll be discharged with an information booklet reminding you of these. These simply mean that you don't put your hip in risky positions while the musculature around the hip joint heals. When you return at 6 weeks, having had regular physiotherapy, it would be great to make sure that you're mobile with a crutch or a stick, or perhaps nothing at all. We would check the wound, and usually it would be safe to drive again. And I'm quite relaxed at this point, if everything's going to plan, to discard hip precautions. So that means you don't have to sleep on your back, you can sleep on your side, and you can start to up the ante with your activities, with the aim to get back to a good quality of life within 3 months of the operation.